New York officials announced yesterday that masks are back on the table as the city heads toward a high-risk designation for COVID transmission in their calculation. And though cases are climbing with an average of 200 infections per 100,000 people, hospitalizations appear to be declining, according to New York City Health. The 7-day daily average was 58 as of yesterday, and that's down from the 28 daily average of 65 per week. Deaths remained about the same, slightly lowered from 4 deaths daily to 3 deaths daily. So that's the situation. But I thought they were citing increasing hospitalizations.
Yeah, I think that stat sounded like it's down over the immediate week before.
Right.
But I think there was an overall trend in growth. So it looks like it's down a little bit from literally last week. Right. But the overall trend has been concerning because it's not just an infection rate, it's a hospitalization rate. And that's what's putting the stress on the medical system and all of those kinds of things, which were our primary concern, even in the post-vaccine days when the implications for any individual were much less severe than they had been before.
Yeah. I mean, I've continued to check DC's data, and for basically the entire last year, our death rate has been the same. There was a slight uptick in the latter Delta stage, but we've hovered around like 1 or 0 deaths per week.
Right. But then, there needs to be a more fulsome conversation. Many people in the disability community have been saying that there's not enough conversation that's going on about long COVID. And some folks even say that it's somewhat suspicious that the Biden administration and public health officials aren't emphasizing those effects more because there is this kind of financial and economic incentive to make sure everything keeps going and keeps running, especially during a midterm season where Joe Biden knows so much of his electability, the Democrats' electability is hinging on this idea that he successfully defeated COVID. So there are a lot of competing interests here that I think are making people really unsure of what to believe or what to do to feel safe.
Yeah, I don't know how you could, even if the situation was a little bit worse than it is now. I mean, any kind of, thankfully it's not really being talked about, but shutting things down again, I mean, how much more can our social fabric possibly fray? With all the antisocial behavior, the rise in just the way people are behaving is not right. And it is so clearly a pandemic, a symptom of what we've gone through. I don't see how we could put people through that again.
What do you make about hitting this million death mark? When the 100,000 mark was hit, a year and a half or so ago, whenever that was, and you had the front page New York Times story, it was framed as this devastating consequence of historic proportions for the United States of America. And now we're at 1 million. And it does seem like there is a disconnect between what has happened and how many people have lost loved ones and the prevailing rhetoric about the virus being inconsequential.
It is not inconsequential. It's highly consequential. It's perhaps the most consequential thing that's happened in our lifetimes. It's a once in a century calamity that has killed 1 million people. We absolutely should talk about what could have been done, if anything, to mitigate that. But the stage we're at now, this is a very, very contagious, highly transmissible disease. It is hard to prevent. You can certainly take steps to reduce your odds of getting it. I think it's hard to reduce them significantly, absent the total, absolute zero COVID lockdown kind of mentality that China has tried and is doing and is making people absolutely miserable, and it is not something anyone wants to do here. There's no public appetite to do that here, which means it is going to spread. There are going to be rises and then falling as waves come through. I mean, it's just the reality. No one wants this to be the reality, but it is the reality. I don't know what more you can expect of people or ask them to do other than get vaccinated if you're not vaccinated, get your booster if you're in a compromised category. We should absolutely be working on the next generation of vaccines or different vaccines, the ones that will be, if people are reluctant to take the mRNA, what alternatives are there? Let's keep up with the changing virus. I support all of that.
The one thing that people could do absent those kind of more severe shutdown type interventions is doing increased masking, And I have observed, in the last few days or so, it does seem to me that there's been an increase in people putting masks back on. And I appreciate that the advice there, obviously masks aren't back officially, but the recommendation is to have a higher quality mask, which is not a distinction that they had been making before. And I think it's something that has driven a lot of the research that shows that masks don't work. I mean, we got cloth masks, obviously, are not as effective.
Don't you want, right? Now it's okay to say, you're allowed to admit it. You were not allowed to admit it previously. We could get the whole channel shut down if we'd said it. You were not allowed to say that masks don't work. You were supposed to be, yeah, masks are great. Any mask, just get a mask. And that was the wisdom for a full year, a year plus. Does part of you wonder if a year or two from now we'll say the same thing about? So that turned out to be wrong.
Maybe, but
I really about the higher quality masks.
Right.
We will know. Look, I'm checking the evidence too. They seem to be doing. I think they somewhat reduce the spread. I don't know how much they actually do. It would not surprise me to find out in the future, to look back and go, that wasn't doing as much as some people thought.
What we do know is what our health practitioners have been doing, and they have been consistently using the higher quality of masks, at least after the very beginning portion where there were all of these supply issues. But they have been exposed to COVID at a higher rate than other people, obviously, as they are treating COVID patients and in a hospital setting. And they have had the benefit of using these higher quality masks and have not succumbed at the rate of most of the population as a consequence of it.
So
I do think we have this natural built-in, they have a higher exposure rate. But there are people who every single day go in and work with COVID patients and aren't getting reinfected every 3 weeks like Stephen Colbert, LOL.
Well, because most people, I don't think, can get. If you've been infected, you have we know natural immunity is actually a really good deal. Buys you weeks at least, maybe probably months in a lot of cases, could be a year plus. Most of the people I know who are doctors and nurses have at some point gotten COVID, right?
I don't know. That hasn't been my experience with, I've got a friend who's a dentist who hasn't gotten COVID, which feels.
I mean, you haven't gotten it yet, so you're a unique holdout.
And I haven't gotten it yet, but also, I am unique.
She's doomed sitting next to me.
I don't have kids that are out in the world and bringing it home to the household. I don't live with a partner. I don't have to be exposed other than now coming and doing this job. So, I know that I'm in circumstances that other people can't be in, but the fact that I am in those circumstances and have been able to take a kind of maximalist precaution view and not gotten it, it's obviously just one person, but it does seem to me to be some indication that some combination of wearing higher masks and engaging in certain kinds of behaviors is protective. Now, obviously that's a choice that people can make, but all I was saying is that I appreciate that the recommendations now are more specific about the kinds of interventions that are more narrowly tailored to actually be effective.
Well, and I appreciate that, obviously, people who work in hospital who know they are coming into contact with people who are symptomatic for COVID, that's the kind of people who come to the hospital, well, yes, it makes sense for them to take extraordinary precautions that I don't think make sense for just ordinary people to do. So that makes perfect sense to me, but I don't even know that, again, probably reduced, absolutely spread likelihood. But there absolutely have been outbreaks that are people getting sick.
Because, these aren't perfect systems. Yeah. But the New York Times is reporting that because of the spread of Omicron, people could get multiple infections, sometimes within just months of each other. This is the point Robby was just making. Earlier in the pandemic, experts thought natural immunity from vaccination or previous infections would stall most reinfections. But according to the New York Times, Omicron has thrown a major curveball to the science.
Now, that's, of course, a report from Apurva Mandavili, who I think is the New York Times most catastrophizing writer on this subject. Writer Matt Iglesias said on Twitter, quote, "When the mRNA vaccines first arrived, it happened so rapidly that we got excited about the ability to pivot rapidly to new variant-optimized vaccines if necessary. Now we have new highly transmissible variants that significantly reduce existing vaccines' efficacy and crickets." So he's making the point that, yes, we need to roll out a next generation of vaccines, which clearly we do. I mean,
yes, and I think that the conversation about how they might not be free going forward is frustrating, and that's my only hesitation. Like, I really appreciate a lot of the conversations that you've instigated about the failures in the broad tailoring as opposed to the narrow tailoring that would be ideal with some of the COVID intervention measures. But I do think sometimes I wish we were, not we, but the broader community were having a more robust conversation about how quickly the government is going to try to withdraw those things that they have been offering up for free in the name of decreasing COVID, because now there is just such a strong political investment that the Biden administration has into pretending that COVID is over, that there's an enormous amount of incentive to say we're going to downplay all of these interventions, including the ones like vaccines that have been free and life-saving. And I just hope that the pendulum doesn't swing so far in the direction of being suspicious of the government for pushing COVID and lockdowns, that we're not suspicious of the government's investment in declining to pretend like an ongoing health crisis isn't an ongoing health crisis.
Sure. I can't think of a better thing for the government to spend public money on researching new vaccines and making them broadly available to the public without mandates and without other sort of other mandated interventions. Obviously, anyone who wants to wear a mask should feel free to do so. I hope it works for them. I hope it helps them out. It's sometimes treated like a moral failing if you get it, and everybody's going to get it. Everybody's going to get it.
The
most masked, the least masked people get it.
Of course, it's an absolutely not a moral failing, and I'm not superior. When I talk about my circumstances, is to say that I'm not superior for not having gotten it. I'm just in a weird circumstances as a person who lives alone and who
I just
is
have
not
among
as
the
exposed.
people. I mean, you're maybe an exception, but among the people I know who've gotten it, which is virtually everyone I know at this point, there was not a discernible difference to me between the deeply irresponsible and the militantly locked down and masked up people.
And you haven't
they have
noticed,
all gotten it.
My observation is a lot of folks in the last month or so are popping up. A lot of hardcore liberals or who have been kind of zealous about this.
Yeah.
Oh, I finally got it. After 2 years, I finally got it. And to me, and again, this is anecdotal, it does feel like when we were told to stop taking some of the precautions that some people had been taking up to present, they finally succumbed. And I do feel a certain degree of peer pressure to say, oh, well, let me not, wear it. It feels antisocial to wear a mask in the elevator the way I was doing. It feels antisocial to wear it, when I got my nails done yesterday. But it does, I don't want that peer pressure to affect what I still think is the best decision making for myself. So everybody trying to just stay in their own lane, whatever works for them.
It also coincides with higher transmissibility, right? I mean, the Delta was, didn't they say 7 times or so? I can't remember the exact statistic, but some wildly higher rate of infection for Delta versus the original strain. Omicron even higher, and we're going to be dealing with, so maybe our interventions were suitable to, and we're taking a chunk out of the original strain. I can believe that.
Yeah.
And we're more justified because we didn't know what we were dealing with. We didn't have vaccines. It was killing people. I mean, it's still killing people, obviously, but it was how do we protect people who are at risk? The risk pool seemed much higher, given that we didn't have anyone vaccinated. It just isn't quite the case.
I do think it's funny that when we're talking about the kind of morality and the judgmentality that has emerged around mask culture, but on the airplanes they announce, you don't have to wear a mask, but please don't judge anybody else for their choices. I read that as don't yell at people wearing masks to take off their masks, which is not the way that this kind of thing is usually covered. The implication is always that the mask people are the ones being the aggressors, but there is definitely some peer pressure that's being thrown around in all directions. So everyone just be nice to each other.
I've flown every weekend this month, I think, and I've been enjoying my maskless flights, and I'd say probably it's about 50% masked and unmasked, which is lower mask rate than I saw some survey. It was saying 3 in 5 people would still wear a mask if on a plane. Well, I guess a lot of those people aren't flying at all because it's lower than that, from what I've seen.
As long as they bring back peanuts.
Coming up next, we'll discuss new polling on President Biden's approval numbers and how the inflation is impacting views on the direction of the country. Our rising panel will join us for that. Stick around.